How's everybody doing today? TJ here, Narrows Labs Ninjas. That's right, keeping it old school. Got the old school Narrows Lab t-shirts. Man, it seems like forever ago that these things showed up. Still in as good a shape as they were as the day they got here. But anyway, that's besides the point. Today, I wanted to talk more about TRT. Seems to be a common topic, a common question that I've been getting quite frequently, and also apologize for the lighting too. Working on trying to get some better lighting here. But I wanted to talk about this because it seems like a lot of guys need TRT and don't know how to go about getting it or necessarily what to do. And so I wanted to talk to everybody about kind of some recommendations on how you can talk to your doctor to be able to get your point across about why TRT is going to benefit you, why you think it's going to benefit you, and the reasons why you qualify. So basically, you're going to be hard pressed to go to any doctor, walk in, and have them just prescribe you testosterone replacement therapy. That's a simple fact. It is a controlled substance, therefore it needs to be attached to a signature. You have to have a doctor that actually can write you this prescription, obviously. So, what do you do when you think you need testosterone and you're showing the signs that you think are from low testosterone, i.e., low sex drive, change in your composition of your body, meaning, you lost muscle that you used to have and it turned into some, more soft, lack of energy, poor sleep. There's so many different things that can come from having low testosterone. Now, the best thing for you to do, and really, depending on the places you go, personally, my TRT is through a private care physician, and I had to, ask for blood work, and I had to go to the doctor. And when I talked to basically not the doctor, but it would be, the person, anybody that you talk to prior to seeing the doctor, you need to explain to them your symptoms. That's probably the most important thing out of all of it, is to make sure that you're absolutely clear that you're symptomatic and explain to them exactly what's going on with you. So if you're having the issues like I talked about, any of them, whether it's the low sex drive or the change in body composition or any of the other ones, you need to make sure that you explain that very thoroughly to your doctor, your testosterone replacement therapy clinic, your, wherever you choose that you want to go get your hormone replacement. We as humans know, or if you're aware, we're in sync with how we're supposed to feel and how our body is normal to feeling. And if you feel like you've had a change, or if you feel like that you could benefit from a little more testosterone in your body, a little more gas in the tank, then the best way, like I said, to go about doing it, explain your symptoms. What that's going to do is it's going to prompt for step number 2. Step number 2 is after you make your phone call, make your appointment, and be sure while you're on the phone to tell whoever you spoke to that you're having issues with testosterone. You need to have a hormone panel done that you think, and also that you're symptomatic and that it's all symptoms of low testosterone, obviously, if you have it. So step number 2, though, that comes after that would be the doctor's going to say that you need to get some blood work done. See, now here's where everybody kind of gets shy, they get gun shy, and they get deterred. Everybody thinks, oh no, well, if my blood work comes back and I fall within range, which unfortunately it's kind of unfairly set up the way that the levels are supposed to be considered normal are it's a very big window, and you can have very, very little testosterone naturally and actually legitimately feel like shit, and the doctor still doesn't have to prescribe you anything. The range that you can fall into with your total testosterone number, which is every amount of testosterone, the whole amount that's running through your entire body. If you can imagine this on a graph now, you're allowed to have between 300 nanograms per deciliter running through your body, anywhere from 300 to 1200. So that means that me, say TJ, I could have 387 nanograms per deciliter running through my body. And you, or whoever you're watching this video, you could have 1,097 nanograms per deciliter. Now, that, with those total testosterone numbers, neither one of us would qualify for testosterone replacement therapy, but I'm most certainly going to be much more at risk to be symptomatic and have, the drawbacks and the feelings of having little to no testosterone, to where you have a higher level and you could feel like Superman. But neither one of us qualify. Doesn't make much sense, does it? I didn't think so. I don't think so either. So basically what you want to do, and a lot of times what, you have to do is you have to be very, very clear on your symptoms. That's most likely if your numbers in your blood work, which come from the second appointment, if they don't fall outside of the spectrum that the doctors want to see, you don't absolutely need that. You can get by with just really explaining the symptoms that you're having and how it's affecting your everyday life. It could be that your girlfriend is upset with you because your sex life isn't what it used to be. Your wife is going to leave you because of that. It could be a change in body weight. It could be a change in mental well-being altogether, depression, whatever it is, all those things. It shouldn't and it doesn't matter really at the end of the day what your levels are on your blood work, as much as it matters how much problems you're having with the symptoms. And any real good doctor, and most generally any clinic of any kind, if they're good and they're worth their weight, what they're going to do is they're going to treat you depending on your symptoms and not the numbers that they're getting off of your blood work. So step one, like I told you, explain your symptoms. Explain them on the phone. Explain them in the first appointment. And make a list. Make sure that you keep track of it so you know every little thing that's going on with you. Step number two, doctor's going to issue blood work. Now, like I said, if you have a good doctor, if you have a good clinic, they're going to, more than anything, they might not give you a prescription right away. You might need to develop a little bit of trust. They might want to get their feet a little bit under them. They might want to see your numbers so they know exactly how much to treat you with. But by the time that you have your third appointment, to where you're reading or looking at that blood work, then you should have a good idea as to what your dose might be or where you might start. Your estrogen levels will also be in there. You're going to ask for a hormone panel. So your thyroid hormone, your estrogen, all of that's going to be covered, or it should be. So the doctor will be able to look at that on that third appointment and say, okay, well, this guy needs this much of an aromatase inhibitor. He needs this amount of testosterone. Maybe you don't need any testosterone at all. Maybe you just need an aromatase inhibitor. We're all different, and we all need different things in order to feel our optimum way. And it doesn't necessarily have to be 1,000 milligrams of testosterone a week. Doesn't necessarily have to mean that, the doctor's going to say, go screw yourself. Here's androgel, for example. Go rub it all over yourself and hopefully your levels go up and you feel better. That's not the case at all. And so I wanted to let you guys know that, something that I've been being asked a lot, like I said, and I figured I would cover. And just remember that if you're not getting the care that you think that you should, then move to another doctor, move to another clinic. Make sure that your symptoms are being treated, not the numbers that's on the paperwork, because the numbers on the paperwork do not always dictate how you feel and where you're at with everything. So that being said, you guys have a good night. TJ25 at checkout for narrowslabs.com saves you 25%, gets you free shipping. Probably the best coupon out there, if you ask me anyway. But anyway, you guys have a good night, and we'll catch up soon.